Okay, sorry nawala ang kuan 'no, ang, ang power, okay. Nag Nag-charge pa ko. Sige, continue ta. Ga-record pod mo guys or nagsalig ra mo sa akong recording? Kinsay ga-record diri? Ga-record pod mo? Wala. Hello? Hello, kadungog mo sa ako? Hello?
Yes, sir. Kadungog, sir.
Okay, kinsa pa'y walay ga-record sa inyo ha? I guess that's a no, no? Sige, let's just see if na-record ba 'to, pero na-download na ako actually. Unta, na-record na ni siya. Sige, padayon ta. Ah, okay. Okay, sige. For muscle wasting, no, we actually inspect, no, or palpate these areas in order to know whether naabay muscle wasting. Again, the temporal part is here. We also have the pectoral and the deltoid. Deltoid is the shoulder. Um, Pectoral is clavicle, scapular sa likod, dorsal kani. Patellar is sa nini mo, okay, and calf. Okay? So katumanggod nga mga regions kay naay muscles, no, and usually mauni ang ma-deplete if naay malnutrition ang patient. Okay? That's why kanang mga cancer patients, no, ma ma-observe ninyo diri nila nga part kay medyo naanay hollow, naanay depression, and that is a warning sign, no, of severe malnutrition. Okay? For fats, naatay mga areas, no, to inspect if na ay fat wasting. We have the orbital kaning pads nato sa eyes nato, buccal kani, upper arm kani, thoracic and lumbar region sa rib nga part. Okay? So, those parts could indicate, no, subcutaneous fat wasting. For fluid status, we usually inspect or we usually assess, no, the edema or kanang panghupong. Okay. For micronutrient status, we usually inspect the mouth, hair, eyes, skin, and nails that could show, no, mga abnormalities and could be suggestive of nutrient deficiencies, micronutrient deficiencies. Like for example, sa mouth, um, kaning oral mucosa, no, if na stomatitis or chelosis, usually it's suggestive of vitamin B complex deficiency. Okay. For functional status, the hand grip strength, okay, with the use of a grip, no, okay, um, mag-apply kag force ana, and if low ang imong hand grip strength, that could mean nga low pod imong protein status. Okay. So these are the physical exam techniques that are usually employed during NFPE. You have the inspection. Inspection is general observation that progresses to a more focused observation using the senses of sight, smell, and hearing. So we also have palpation, gentle tactile examination to feel pulsations and vibrations. Assessments of body structure, including texture, size, temperature, tenderness, and mobility. Okay? But among these techniques no, ang atong ginagamit sa NFP is inspection and palpation. Kaning percussion and auscultation, rare lang ni siya ginagamit sa NFPE. Okay? Usually mga doctors ang gagamit ani nga technique. Okay? Percussion is assessment of sounds to determine body organ border, shape, and position. Auscultation is through the use of stethoscope to listen to body sounds. Okay? Clinical assessment also includes medical history of the client, like past surgeries and previous diagnosis by other physicians, number of childbirth disorders of other family members, etc. So the measurements of blood pressure and pulse rate are also included in the clinical assessment. And kaning blood pressure, uh, usually ginagamit nato ni siya sa sodium status because kung taas ang blood pressure, that means siguro taas po di mong sodium intake. Okay? This is also used no for hydration status. Kay kung mubo imong blood pressure, usually dehydrated ka. Kulang ra kag water. Okay? Sige, advantages of clinical assessment. It can be performed on many individuals in a short period of time. It is also less expensive and it can be performed by other clinical staff given the proper training. Okay. The disadvantages include it is not an acute indicator of literature. Again, long-term ni siya, just like Anto. Overlapping of deficiency states. Dili kaayo nato ma-detect ang specific nga nutrient deficiencies unlike biochemical. And like Antro, clinical assessment is also more prone to human error because this is subjective. We rely on our senses, so subjective siya. That means it could mean it could be different. The measurements could be different from one professional to another professional. Okay? Unlike kung laboratory nga kung unsay result mao gyud na kay nagamit tag instrument for that. Okay? Di pud siya kayo invasive although dapat sensitive ka no sa kuan sa for example magpalpate ka usually na ay kung babae ang patient then dapat ang professional nga magdug NFP is babae pod di ba so na ay gender sensitivity nga part no okay. For dietary assessment, so this is just what we did sa chapter 2. Okay? Mag-use ta og mga tools in nutrition. So this is the measurement of dietary intake. So for example, how many calories does one consume, how many vitamins, minerals, nutrient substances. So the results are derived through the use of FCTs and nutrient analysis software. The results are then compared with the dietary standards like PDRI. And dietary assessment also includes identification of any food allergies or food intolerance, level of alcohol intake, and other dietary concerns and problems like um, problems in the GI function. Okay, part ya po na siya sa dietary assessment. So we have these basic methods used in the dietary assessment. We have the retrospective methods that include 24-hour food recall, FFQ, and diet history. We also have food records as the sole prospective method. Okay, when you say retrospective from the past and prospective in the future. So, uh, for example, magdo tag 24-hour food recall. So this would ask you to list all of the foods and beverages that you consume for the previous 24 hours, for the last 24 hours. So retrospective siya because from the past man, mag-recall ka sa imuhang gipang kaon, gipang consume from the past 24 hours. Okay? What about FFQ? Uh, this measures no the frequency of your food intake. Okay? Kung kapila ka nagkaon ani nga food. Okay? From the past week or from the past month or from the past couple of months. or naay FFQ nga from the past year. Okay, so that's why retrospective siya. Diet history is much more comprehensive than FFQ, and from the term itself, history, this would also measure, no, or determine your food intake from the past. Okay, prospective method is example is food record. And actually, no, this is the most accurate method among the four kaning food records. Okay, sa maning food record, um, you will be asked not to record all of the foods that you take at the same time. Like for example, nag-breakfast ka karon. So para dili na ka mag-recall, ilista na lang ni mo daan while you are having your meal. Okay? So therefore, food records eliminate the need for recall. Okay? Kay you list man the foods that you consume at the same time. Okay, so that's why it's called the prospective method. Okay? Usually manggod magka-error tungod sa recall. Dili ta maka-recall ba maayo sa ato ang gipang kaon. So dili na to ma-accurately record ang atong gipang kaon. So the food records eliminate that error. Okay? So kani guys, I will just leave this for your own reading. Okay, kay medyo taas-taas naman siya and this is pretty self-explanatory. So basahon lang ninyo ni the advantages and then the disadvantages of each of these methods and the applications. Okay? So natay sample nga mga form, no. For example, for FFQ, kani mao nitong giingon nako that determines the frequency of food intake, like for example milk. So kapila ba nimo giinom, kapila ba ka mag-inom og milk, more than once per day or once a day or two to three times a week, seldom or never. So you just check the one that best corresponds to the frequency of intake. Okay, this is the sample form for 24-hour food recall. Okay? Tanan nga foods, tanan nga beverages, even water, and even alcohol and supplements nga imong gitake. Okay? Yeah, kay kani pwede man ta magamit din og FCT para ma-determine nato pila ang, or even FEL for the macros. And then for the micronutrients, FCT. Okay? Para ma-determine na to pila ang, for example, iron. And then ma-compute na to ang percent PDRI and ma-determine na to whether inadequate ba ang yang intake or just adequate or excessive. Okay? Um, if less than 75% ang percent PDRI, then that's inadequate na intake. Kung 75 to 125, that's adequate. Kung beyond 125, that's excessive. Okay? Sige, so that's dietary assessment. Okay? So, adili naman ni siya kay stranger sa inyo ha, kay mao man ni atong gihimo basically sa chapter 2. Okay? Sige. Mao ni example sa form sa assessment. Usually ginagamit sa hospital no kani. But mao ni ang pinaka-standard guys, kay mao man ang pinaka-accurate nga assessment form which is called the subjective global assessment form. Okay? Naay antro diri, weight or weight change, dietary intake, dietary assessment, GI symptoms kay part na siya sa dietary assessment, functional capacity part of the clinical assessment, physical exam part of the clinical assessment kay mao man ning NFPE. Okay? Kani disease state or comorbidities as related to nutritional needs, kay as what I've explained, the disease of the patient itself has an effect to the nutritional status because usually ang ang disease no ang reason nga nung di ganahan magkaon ng patient. So that's why i-note pud nato diri. And ato na siya i-rate no such that ang total ani ah makaingon no if well nourished ba ang patient or if naa ba siya mild to moderate malnutrition or severely malnourished siya. For example, ang rating nimo, ang total nga rate nimo is 6 or 7, then that means well nourished ang patient. But if 3, 4 or 5 ang total nga rating, then mild to moderate. But if 1 or 2, then that would mean nga na ay severe malnutrition ang patient. Okay? So, yeah. Um, this is how we use the subjective global assessment form. Okay. For example, nag-rate ka diri og kanang ah 0, 0, 1, 0, 1, 0. So pila ra to? Duha ra nga 1, so 2. So kung 2 imong rating nga total, then severely malnourished ang patient. Okay? Sige. So I hope naamoy lab activity ani karon no. I don't know if naamoy lab activity on how to use the SGA, but if wala man galing, then you will definitely learn that no sa nutrition therapy nga subject. Okay. So remember that an effective nutritional assessment means using not just one method but as much as possible all methods to supplement and complement one with the others. Okay? So para effective no atong assessment para ma-successfully determine nato unsa ang nutritional problem sa patient, we have to use more than one of those methods. Okay? Kay dili man pwede nga mag-rely ra ka for example sa clinical assessment without the biochem. Okay? For example, na notice nimo nga ang patient kay na ay koilonychia, okay? Na siya spoon-shaped nails. That could suggest nga naa siya iron deficiency. But in order to confirm that, in order for us to be sure, dapat magtan-aw ta sa biochem assessment. So tanaw na to ang lab assessment sa patient. If mubo ba yung hemoglobin, if mubo ba yung serum ferritin. Serum ferritin is another measurement no for iron deficiency. If mubo manggaling yun to, then that would confirm nga naa gyud ay siya iron deficiency. So since na-diagnose na nimo nga naa siya iron deficiency, then what would be your action? What would be your intervention? So dito na dayon ka mag implement og diet that is rich in iron, pwede ka mag-prescribe og iron supplements, okay? And of course, i-counsel na tong patient, educate na tong patient unsa nga mga foods ang taas sa iron, okay? So yeah, so that's how you deliver nutrition care services to the patients, okay? Balik ta dito sa figure nga atong gi-skip ganina. Kani. Okay. So, we have different stages no of uh, development of deficiency. Okay? This would tell us kung unsay nga ma, pinakauna nga ma-observe nato no if the patient develops certain nutrient deficiencies and unsa to nga mga markers ang late na no nga signs of deficiency. Okay? First is inadequate intake or absorption or increased nutrient requirement. Okay. So that's why ang makadetect ani is dietary assessment. Okay? Mauning pinakauna nga mahitabo sa development of deficiency. Kulang ang imong intake sa kaninga nutrient. Then next nga mahitabo is body store tissue level depletion. So ma-deplete imuhang lawas o kani nga mga nutrients. Okay? Kay inadequate man imong intake. Okay? So, mauning second nga mahitabo. Katulo is biochemical dysfunction, then ikaupat physiological dysfunction, then cellular dysfunction, then dili na dayon mahitabo ang clinical signs and symptoms and morbidity. Okay. Diri na mag-show, no? Diri na mag-manifest ang disease. And then the last is, of course, mortality or death. Okay? So each of these stages can be detected by each of those nutrition assessment methods. Ang makadetect sa earliest sign of deficiency is the dietary assessment. Then ang ikaduwa is ang biochemical assessment. Okay? Because remember that the biochemical assessment measures the nutrients in these compartments. Then the clinical assessment or nutrition focused physical exam diri na sa clinical signs and symptoms. And wala lang nabutang diri no, but diri pud na include ang antro. Okay? Client history is part of the clinical assessment. So kani clinical assessment gihapon ni. So that would confirm no katong mga advantages and disadvantages no sa kaning mga assessment methods nato. Remember that the um, long-term markers of nutrition of the nutritional status are the clinical assessment and antro. Okay, because uh, we can only detect no uh, the late signs of deficiency through the use of clinical and antro. But if we want to detect the earlier signs of deficiency, then we must rely on the dietary and biochemical assessment. Okay? So always remember that nga kanang mga abnormalities nga makuha nga makit-an nato sa dietary and um, biochemical mao nang mga early signs of deficiency. But kanang ma-detect nato sa clinical and antro mao na ng mga late signs kay long term naman gud na sila nga mga changes sa nutritional status. Okay? So that's it. That's how you interpret this figure. Another illustration of that is this one na tay mga stages po of micronutrient deficiency. So actually parehas rin ni siya ani nga figure ay nga table. Stage 1 is this depletion of vitamin stores which can be detected by biochemical assessment. Non-specific biochemical adaptation like decreased excretion of metabolites in the urine, this is urinalysis, so this is part of the biochemical assessment. Secretion of micronutrient dependent enzymes or hormones reduced, so na ay part diri nga ma-detect sa biochem, and diri sad nato makita ang first physical signs which can already be detected by clinical assessment. Okay, if you observe the patient to be experiencing like lack of energy, malaise, loss of appetite, or insomnia, then part na ni siya sa clinical assessment. Kaning reversible impairment of metabolic pathways and cellular function, clinical gihapon ni. And ang stage 5 is irreversible tissue damage. This is clinical gihapon, and diri pod mahitabo ang antro, ang changes sa antro. Like for example, if stunting, like ang bata putot no, uh, short ra gyud kaayo for her age or for his age, then that's a long-term consequence of poor nutritional status. Okay? Yeah. So, that's it. Um, if naatay makitaan nga kato, koilonychia or spooning of shape, spooning of nail, that means dugay na gyud kaayo na di ay nga deficient siya sa iron. Wala lang siya na-detect earlier. Okay? But if wala pa nagmanifest sa iyahang mga nails, sa iyahang lawas, dili pa siya gaka-experience og pallor, pero mubo na iyang hemoglobin, then congratulations, you detected the early sign of iron deficiency. So, our goal in that case is to prevent iron deficiency from progressing to the point nga magmanifest na siya sa clinical assessment. Okay? So, we we have to prevent that. Okay. So yeah, I think that's it, guys, for the chapter 3. But before tama human ani nga chapter, no, I just want to show you uh videos, no, of the NFPE and videos about the use of bioimpedance analysis and DEXA, which are part of the anthropometric assessment. Sige, let's kuan sa ano ang ang NFPE. Okay. Uh, YouTube. Reset sa NFPE di ay.
First, we have Grammarly. The free version checks basic spelling and grammar. Grammarly Premium on the
Evaluating for loss of subcutaneous fat, muscle mass, as well as micronutrient deficiency. The nutrition-focused physical exam is essential to the identification of malnutrition. This video will demonstrate how to incorporate the physical exam into your nutrition assessment. We will be evaluating for loss of subcutaneous fat, muscle mass, as well as micronutrient deficiencies. This video will demonstrate an ideal scenario. Adjustments may need to be made depending on the condition of each patient.
Good morning, Mrs. Jones. My name is Janine. I'm one of the dietitians at the hospital here.
Good morning.
Your doctors wanted me to come by and speak with you regarding the weight loss that you had reported before coming into the hospital. Can you tell me a little bit more about that?
Sure. Well, I don't usually weigh myself, but over the last month or so, I've noticed that my clothes are getting baggy, and I've started to wear a belt, which I never used to. I usually think my weight's about 115, but when they weighed me this morning, they told me it was 105, and that was a surprise.
Okay, so you're saying you think the weight loss occurred over about the last month?
Yes.
Okay. And what do you think may have caused the weight loss?
Well, I guess I've been eating a lot less than I normally do, but I also haven't been doing anything. I haven't been as active as I used to, so I thought I didn't need to eat as much.
I understand you have difficulty breathing. Have you been having more shortness of breath over the last month?
I've been getting tired very easily with just about everything I do, even eating. My daughter's been helping me to make meals, but with my appetite, I just haven't had the appetite to eat much.
Well, we'll definitely set you up with some nutrition supplements while you're here, and then we'll create a nutrition plan for you at home. That way we can prevent any further weight loss. As part of my nutrition assessment, I complete a physical exam where I look at some different areas of fat and muscle to see if there's been any changes there. I also look for any vitamin and mineral deficiencies. Would you be comfortable with me completing this exam today?
Yes, that would be okay.
Okay, great. Thank you.
Here, the dietitian will complete her head-to-toe exam, looking for both subcutaneous fat and muscle loss, and any potential micronutrient deficiencies. Throughout the head-to-toe exam, the dietitian inspects the skin for color, moisture, texture, temperature, and lesions, as abnormalities may indicate micronutrient deficiencies. First, the dietitian is evaluating the patient's hair quality, looking for change in texture, dullness, thinning, or
So that's
pluckable hair.
inspection, no?
The dietitian then
technique
palpates the
in
temples
FPE,
bilaterally,
NFPE.
evaluating for any depression or scooping.
Okay, that's
Severe
palpation.
loss will be very hollow or scooped. The dietitian then moves to the orbital region,
Okay, that's
where she
for
palpates the
subcutaneous
bony
fat.
ridge directly under the eyes to evaluate fat stores. The dietitian will take a closer look at the eyes and the oral cavity to
Okay, that's
evaluate potential
micronutrient exam, no?
micronutrient deficiencies. The conjunctiva, followed by the sclera of the eyes, are evaluated. All aspects of the oral cavity, including the lips, corners of the mouth, tongue, teeth, and gums, are evaluated for any irregularities. The dietitian then asks the patient to sit up and evaluates the clavicle region and deltoid muscles
Okay,
for
for
any changes
muscle,
or loss of muscle mass. While the patient continues to sit up, she extends her arms straight out pushing against the hand of the dietitian. Here, the dietitian is evaluating the muscle groups around the scapula bone for any prominence or depression and checks for a nice coating of muscle around the bone and spine area. The dietitian then guides the patient's arm into a 90-degree angle, being mindful of any IVs and lines to evaluate the upper arm region for any subcutaneous fat loss.
Okay, that's fat.
The
or
RD
fat.
takes hold of the tricep and gently rolls down her fingers to separate muscle from fat. If fingers are touching,
Okay,
only
what she
skin
does now
present,
is
indicating
palpation.
severe loss of subcutaneous fat. While the patient remains seated upright, the dietitian examines the thoracic region for subcutaneous fat. The RD gathers fat from the bottom of the ribs to the top of the iliac crest. Approximately 1 inch of fat indicates good fat stores. Ideally, this would be done from a standing position, but can be completed if the patient is seated upright, without pressing back on a chair or bed. The dietitian now moves down to examine the patient's hands. Here, the dietitian examines the interosseous muscle. At the same time, the dietitian evaluates the patient's nails, nail bed, and perfusion for any potential micronutrient deficiencies. This is done by gently pressing down on the nail beds and examining nail quality. Now, the dietitian will move down to examine the lower body. First, the dietitian will keep an eye out for any edema that may alter the exam, or that may be causing the patient discomfort or pain. The dietitian will examine the anterior thigh with both hands, looking for any depression. She will look at the muscle around the patellar region for any prominent bones, and lastly examine the posterior calf for muscle definition. If the patellar bone is very prominent with no apparent muscle loss, the loss is considered severe. Edema can be evaluated at this time by pressing gently on top of the patient's foot and ankle to determine presence and extent of edema, again being mindful of any pain. For ICU patients or those unable to participate, it may be wise to check in with or notify the patient's nurse prior to performing the exam. A similar exam can be performed being mindful of condition, injuries, as well as IVs and lines. The
Okay,
nutrition-focused physical
that's
exam
clinical
can be a
assessment
valuable
done
addition.
in the hospital. Sige, let's also watch a video or a clip about the use of bioimpedance, which is part of the anthropometric assessment. Bioimpedance analysis.
It's fun. I know, asa ba, Bedo?
Hi, I'm Dr. Dale Wagner, an exercise physiologist, and we're here in the lab today to do a body composition measurement, and we're going to be doing that measurement using bioelectrical impedance analysis, commonly just referred to as BIA. So BIA sends a low-level electrical current through the person's body. It's so low that the person can't feel it. It's a low voltage, low frequency. And with that electrical current, of course, a large portion of the body is water, so generally we're good conductors. And the water content in the body is found in the fat-free mass. So the fat mass is essentially anhydrous or free of water. And so the only thing that's impeding the current is the fat mass. And that's really what we're measuring when we do bioelectrical impedance. We're measuring the impedance or the resistance to the electrical current that's going through the person's body. So the first thing that we're going to do is we're just going to clean up some areas on our subject's skin so that we have a good conduction. And we're going to be placing 4 electrodes. So we'll have 2 electrodes on the wrist and hand and 2 electrodes on the ankle and foot. And we're going to be using the same side of the body for those electrodes. Traditionally, we measure things on the right side, even though I'm on the left here, that's fine. This is a relatively easy procedure. It's not difficult for the client or the examiner. So that's probably one of the benefits of this method. However, despite the fact that it's an easy procedure, you still have to be very precise on your landmarks in order to get an accurate reading. So I'm using some anatomical landmarks here, bisecting the styloid processes of the radius. And this one goes in the down on the proximal phalanx of the middle finger. Down here, I'm going to bisect the malleoli.
Anyways, pwede na ta mag-skip dito.
So we want to make sure that she's not wearing any metal, because of course metal is a good conductor. And so you're not wearing any metal, right? Okay, and so that's it. Our setup is all ready. So we're just going to hook up the electrodes here. We have red and black leads, just like hooking up a battery on a car, basically. And our red lead is proximal, black lead is distal. And it's very simple. From here I just turn on the device, and it's going to give me a resistance reading. And so this is measuring the resistance to the electrical current going through her body, and this number is in ohms. So right now she has 534 ohms. That number in and of itself, just by itself, doesn't mean anything, but we take that information, we put it into an equation. Other information that we would have to know for the equation would be her height. Her height is critically important because, as with any electrical current, the resistance of that current is dependent on the height and the cross-sectional area of the cylinder. And so in this case, the electrical current is going through her arm, down the side of her body, over to her leg. So we're really measuring the whole body, but half of the body, and then making a prediction based on that measurement. So certain advantages to this method, as you can see, I'm not dependent on body fat.
Okay, so that's it. So this is just one of the examples of the instruments used for BIA. The other one is katong standing, dili siya mo dili siya mo mo lie down. So katong standing nga BIA ang available sa ato diri. Okay? Kani kay mas expensive man gud ni siya. Okay? So katong value nga na gather didto, ikuan to siya sa equation, no, para ma-determine kung pila ang body fat niya, pila ka percent ang body fat niya, pila ka percent ang muscle mass niya. Okay? Naapod tay DEXA analysis.
So yeah, the MIP, Connor Taylor's taking my DEXA scan today. Here is.
Hello.
So where are we, Connor?
This is the Manchester Institute for Health and Performance. We're going to get Phil's body composition measured today.
Oh, nice. Here we are.
Here we are in the DEXA room. So I'm going to get you weighed. But do you have everything out your pockets? Coins and stuff, yeah.
Correct, yeah.
Okay, so no metal on you?
No.
No piercings. Head up this end on the back, please. Okay, I'm just going to make get it down a bit. Fantastic. Hands by the side. Just go strap your legs in, relax. Okay? Yeah. So as well as general monitoring when a ride is going as well as Phil is currently, it's good to capture as much data on them as possible. Help us inform our performance profiles going forward for the next cycle. Philip, just try to stay nice and relaxed. Just take about maybe 6 minutes to review. Ready? Yeah.
Okay, so 'di ba from that procedure maka-print dayon og result, no, that would show you the compartments of the body, kung pila ba ang body fat, pila ang fat-free mass.
Density. Very good.
It's good. It's improved since last time.
So yeah, that's it. So usually kani ginagamit ni siya sa sports nutrition, no,
Everyone loves
to better estimate the level of body fat and level of muscles, no, sa mga athletes, which is very essential because we want to maintain certain levels of body fat and muscle mass for our athletes para optimum ilahang athletic performance through diet. Okay, so that means if wala niya na maintain, no, certain level sa body fat or certain level of muscle mass, siguro there is something wrong with the diet. Okay, so that's why parts assessment, no, ang assessment of body composition. Okay, so that's it, guys. So naamoy questions so far? Questions? Gamay na lang kaayo mo ay nagsalig ng uban sa recording. Nabay questions? Okay. As what I've told you over your GC, no, na ako'y i-upload ng mga case study. So, for chapter 3 case study, that is all about assessment, no? So here, so very short naman siya. But definitely, ma-apply ninyo yung na-learn from this chapter to answering the questions that are indicated here. And for the chapter 4 case study, so kuha na lang pud nako in advance para at least makasugod na mo, no, kung unsa lang ang pwede ninyo maansiran diri. Okay? But of course, ipasa man ni siya after pa sa atong after ta mahuman sa discussion nato sa chapter 4. Okay? So, but advice lang, no, medyo taas-taas ra ba to siya nga case study, so para dili mo mag-cramming, no, pwede na ninyo sugdan og answer. Okay? Sige, so naapatay questions before ta mag-dismiss? Wala. Okay. So, I think that's all for today. So, we will meet tomorrow for our discussion on carbohydrates, which is the first part of chapter 4. Okay? So, wala na. Wala questions. Okay. Sige. So, that's it, guys. Thank you for coming to our class today, and I'll see you tomorrow. Goodbye.